Hi everyone, I'm Rhiannon, a final year vet student from CSU in Wagga. As part of my assessment, I was asked to research Bovatec, or lacilloside toxicity in cattle. This video will provide the highlights from my research and hopefully some insight for producers on how to avoid lacilloside toxicity in cattle. Lacilloside is marketed by Zoetis and other brands, but it's best known as Bovatec. Lacilloside is an ionophore, most commonly used in calf replacer to prevent coccidiosis, but it can also be found as a feed additive for cattle being fed high concentrate feeds in order to improve feed efficiency and weight gains. It's a product similar to monensin, which is also known as rumensin. All ionophores work in the rumen of cattle to alter bacterial populations. It alters the movement of sodium and other minerals and water through cells, and it displaces water from its normal position in the body and can cause a number of different clinical signs in cattle depending on the dose consumed. When used in the recommended dose range, expansion and rupture of coccidia and certain bacterial populations in the rumen occurs. This helps control coccidiosis in calves and alters the rumen biome in cattle to improve feed efficiency. Toxicity occurs when lacilloside is consumed in volumes larger than the recommended dose range. This movement of minerals and water will now affect the animal, not just the organisms living in the rumen. Initially, it causes dehydration of the animal and progresses to cause rupture of these cells. This is what causes damage to organs, such as the heart. Signs often found with lacilloside toxicity include acute sudden death, loss of appetite, aimless wandering, apparent blindness, muscular stiffness, depression and lateral or sternal recumbency, increased respiratory effort, and opisthotonus, which is neck, back, and stargazing. Deaths can be acute or progressive, with some cattle dying in the days after an overdosing exposure. Diagnosis of lacilloside toxicity can be difficult for vets due to it mimicking many other conditions that cause similar muscle damage. It can appear like other ionophore toxicities, toxic plants, or vitamin and mineral deficiencies. There's currently no tissue or blood concentrations that can be measured to show an overexposure of lacilloside. So diagnosis is based on vets viewing the clinical signs, knowledge of the history of feeding lacilloside, and ruling out other causes of death such as toxic plants and deficiencies. There's no specific antidote or treatment for lacilloside in animals, including cattle, horses, or dogs. Prompt removal of feed or cattle from feed when clinical signs present can stop the ingestion of further product. Symptomatic critical care of clinical animals is what's recommended. Some treatments a vet may use include oral laxatives to move the contents through the GIT quicker, anti-inflammatories, IV fluids, and/or pain relief. It would be recommended to complete a feed analysis to evaluate the dose of lacilloside present in the feed and the dose likely that the cattle consumed. In the management and prevention of lacilloside toxicity, it's important to follow the instructions and be aware of the risks when feeding lacilloside products to cattle. Lacilloside is not a free choice product. It should be correctly mixed, evenly distributed into a ration which is correctly calculated to avoid overdosing. It's important to allow the time to introduce lacilloside into a ration. It requires a period of 6 days to be introduced into a ration so that cattle ingesting the feed can have their gut biome adjusted prior to consuming large quantities. Monitoring and observing all animals on new feed carefully is important, as prompt removal may avoid further clinical signs or losses. Avoid feeding lacilloside and other ionophores to hungry cattle, which may overconsume the product when given access to feed. Finally, storing lactulose and other products in good storage units is important to avoid leaking and contamination with moisture. This will avoid changes of the ionophore concentration in the feed and avoid overdosing. I would like to thank the HVC for having me for my rotation period, and I hope that this has provided some information for producers on lactulose or Bovatec and how toxicity may be prevented. Please contact the team at Holbrook Vet Centre to be in contact with a vet should you want to know more.